Dear all, good morning. Robin Leroux from Nantes Hospital. I'm here at TCT and I'm pleased to present you the results recently presented by Santiago Garcia about the TRISCEND patients implanted with leads. So the brief background is that we have seen in the TRISCEND trials that the issue of new pacemaker implantation was the rate was high, and we also know that the tricuspid population that undergoes TEER is also composed of patients with frequent lead that are transvalvular. So this study included the TRISCEND and TRISCEND II databases, and in total 435 patients were included. Of them 52% didn't have any leads, 35% had lead across the tricuspid valve, and 12.6% were implanted after the intervention. The results were landmark at 30 days, and basically what we have seen in terms of baseline characteristics, the patient with prior CIED lead across the valve were more comorbid, with higher higher prevalence of prior CABG and higher Euroscores and slightly lower LVEF. The results that were landmark at 30 days included safety outcomes that was a composite of mortality and heart failure hospitalization, whereas efficacy was reduction in TR with a clinical response based on NYHA, QCCQ, and 6-minute walk test. Basically, regarding the efficacy endpoint, the results were similar between those three groups, whereas the safety showed that in an unadjusted analysis, the patient with prior leads had higher clinical events after the intervention. But after adjusting to the comorbidities that characterize this population, there was no difference anymore. So, in looking at the specific group that required pacemaker implantation after EVOQUE implantation, of those 152 patients, 10 presented with lead-related events, and the majority of them needed a replacement or a repositioning of the lead. So just a few reminders regarding the limitations. Those studies excluded patients that were pacer dependent, so that's particularly a population that is at risk, and outcomes were landmark at 30 days. So as a conclusion, we can say that in terms of efficacy, safety of the procedure, that safety was the same across those three groups, and that the need for a new pacemaker implantation apparently didn't impact the prognostic outcomes in this population. More importantly, the patients with prior CAED that undergo EVOQUE implantation have the same reduction in TR. However, there might be some caution regarding the risk of lead-related events, and this obviously requires longer follow-up and larger data sets to be sure that this is really safe at midterm and long term.